My name is Shashank Sinha, and I'm an advanced heart failure and transplant cardiologist at Inova Shar and Heart and Vascular at Inova Fairfax Hospital in Northern Virginia, where I'm an assistant professor of medical education at the University of Virginia School of Medicine and serve as the medical director of our cardiac intensive care unit in cardiology and director of the cardiovascular critical care research program.
I'm Dave Morrow, the section head of critical care cardiology at Brigham Women's Hospital and a professor of medicine at Harvard Medical School.
Why did we write this statement? And I'd like to kindly ask Dr. Morrow, as the chair of the 2012 AHA scientific statement on the evolution of critical care cardiology, to briefly comment on the origin story for that statement and how have you felt the field has evolved over the past decade since you published this landmark document?
We undertook the 2012 scientific statement with the purpose of outlining several key areas: organization, staffing, fundamentals of care delivery in the CICU environment, training, and research. And I think since then, now more than a decade later, all of those things are still just as important as they were more than 10 years ago. The field is still maturing and really at a very rapid pace. The complexity of our patients, the complexity of the care that we provide and that we deliver in advanced cardiac ICU seems to be inexorably progressing. And so, I think it's a strength of this current update that it integrates all that we've learned over the last decade with more evidence and more experience in this evolving ecosystem of critical care cardiology, and comes back to the key foundation, which is that it's essential for us in our cardiovascular professional societies to lay out a roadmap. And I think this updated statement fulfills that crucial need again in what I think is a very exciting phase of continued growth and maturation ahead for the field. And we're all ultimately aimed at providing the best possible care that we can for our sickest cardiovascular patients.
With that background in mind, I'd like to share with our audience that our goals in this paper were really to provide a timely update, a contemporary perspective on the organizational structure, staffing, and care delivery in the contemporary cardiac intensive care unit, examine challenges and opportunities that are present in our educational and training environments, particularly for the next generation of physicians for critical care cardiology, and then explore quality improvement initiatives and scientific investigation, including multi-center registries like the one that Dr. Morrow leads, as well as randomized clinical trials that hopefully have the potential to change clinical practice, care delivery, and the research landscape over the next decade.